Hey everyone, this is Dr. Jad, and today we're going over the MRCP PACES Cardiology station. Watch this video till the end to get all the tips that allowed me to pass with just 11 days practice. We're going to be taking the tips from the first video in this series and applying them to the cardiology station. Before we continue, a quick disclaimer. I don't recommend leaving your exam preparation for the last 2 weeks. I just wasn't given a choice as I'd been put on the waiting list and I didn't think I would be given a slot. Now that's out of the way, here are my top tips. 1. Identify the most common stations. This is a really important first step. Once you identify the most common stations, you can prioritize your studying. Let's take a look here. 10 conditions account for around 80% of cardiology cases. These conditions are prosthetic aortic valve, aortic stenosis, mitral regurgitation, aortic regurgitation, mitral valve replacement, mitral stenosis, atrial fibrillation, mitral prolapse, mixed aortic valve disease, and ventricular septal defect. So if you learn these 10 conditions inside out, you're really stacking the odds in your favor. Of course, you want to study as many conditions well as you can, but it's great to be able to maximize your chance of success like this. Now that you know what to study, you also need to know how to study. This brings us on to number 2. Structure your studying. If you have a clear system, it will be much easier for you to recall crucial information during the exam, especially as you're going to be nervous. The structure I used was signs of disease, signs of severity, signs of etiology. This specific order lets you examine and present your cases in autopilot, as well as answer questions from the examiner effectively. So let's take aortic stenosis as an example. The classic sign is an ejection systolic murmur heard loudest at the aortic area, which radiates to the carotid arteries. Signs of severity include a slow rising pulse, S4 heart sound, and left ventricular failure. And the most common etiology is age-related calcification of the valve. These are only a few examples, but using this system will make remembering this information and getting into the right mindset so much easier. 3. The importance of a confident presentation. Remember, the examiner wants to know that you're competent, experienced, and a good communicator. I will give you an example of how to present a case using aortic stenosis as an example. I examined this 50-year-old male who had an ejection systolic murmur, heard loudest at the aortic area, which radiated to the carotid arteries. This is consistent with a diagnosis of aortic stenosis. Importantly, he did not exhibit any signs of heart failure and other signs of severity, including a slow rising pulse and an S4 heart sound. This is a concise, well-structured presentation that paints a very clear clinical picture to the examiner, and this is what you will be expected to do on the day. There's no one way to do it, and the more studying and practice you do, the more comfortable you will become with your personal style. 4. Impress the examiner with knowledge beyond the curriculum. This will set you apart from the other candidates, although it's important to remember that you're not in direct competition with anybody. Just remember one fun fact per condition and you'll be fine. With aortic stenosis and other valve disorders, you can roughly grade it into mild to moderate or moderate to severe. If you find any signs of severity, grade it into moderate to severe, and if not, grade it into mild to moderate. This is a simple trick that can get you extra marks. 5. Anticipate the examiner's questions. The examiner will ask you to present your findings, discuss initial investigations and treatment, so you already know what sort of questions to prepare for. But you can give leading answers to fill up some of the questioning time with topics you know about. For example, with aortic stenosis and other valve disorders, you can mention during the questioning whether your patient had or didn't have signs of severe disease, if you didn't do so in your presentation. They are then likely to ask you to list these signs, which you would have already prepared for. Of course, it's important to remember that your examiner will probably have some questions that they're going to want to ask you regardless, so this isn't a completely foolproof system. 6. See signs. As important as practicing with hospital patients is, it's just not that efficient. We've all spent hours trying to see 1 or 2 patients. You'll never get the exposure to all the signs and pathology this way. By picking the right online revision resources, you can make your revision so much more efficient. The 2 online resources I used were PassTest and Clinical Skills Pro. I personally think it's a good idea to use them both because the mixture of pathologies, presenting and questioning styles will make you dynamic enough to think on the spot and ace your exam. By not relying on one resource only, It makes you much better at thinking on the spot under exam pressure. I don't think I would have passed without using both PASS Test and Clinical Skills Pro, so I would recommend them both. Even though it costs more money to use both, you can use my discount codes in the description below to save money, and it's much cheaper than repeating the PACES exam, so I think it's a worthy investment. Now you know the secrets to acing your cardiology station. I hope this was useful. Please like and subscribe so you don't miss out on any tips on how to pass your PACES. Feel free to ask any questions in the comments section, and see you in the next video.